Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, in this video we can see some important points for exam. And the today's topic is examination of urine. That is mainly the characteristics of normal urine and characteristics of abnormal urine we can see in this point section. And first is oleum of urine. Normally 1000 to 2000 ml of urine is excreted in 24 hours, but the amount or the output depend upon the intake of water. It may be varies. Okay, normal volume of urine is 1000 to 2000 ml in 24 hours. And important point, abnormal increase in volume of urine is known as polyuria. Polyuria means abnormal increase in volume of urine, and this is mainly found in diabetes mellitus and diabetes insipidus. Diabetes mellitus, one of the cardinal sign of diabetes mellitus is polyuria, and also this polyuria is seen in diabetes insipidus. And the next point, decreased quantity of urine is known as oliguria, and this is mainly found in heart disease, kidney disease and in shock. Okay, that is oliguria. Oliguria means decreased quantity of urine. And the next point, total absence or marked decrease of urine is known as anuria, and failure of kidney to secrete urine is known as suppression. So anuria and suppression important points. So we discussed polyuria, oliguria, anuria and suppression. Next we will see the color of urine. Okay, normally the urine is pale yellow or amber color, and the pH is below 7. Okay, urine pH. The color of urine, when the content or quantity of the urine is increased, the color become pale yellow. When the quantity of urine is decreased, the color become deep yellow color. Okay. Next is the specific gravity of urine. The specific gravity of urine is 1.016 to 1.025 is the normal specific gravity of urine. Specific gravity of urine is high in case of diabetes mellitus and low in case of renal disease. This is very important points. That is, specific gravity is increased in diabetes mellitus and decreased in renal disease. And next is the constituent of urine, that is content of the urine. Normal constituent of urine are 96% of water, 2% of urea, and remaining 2%, that is total 100%. In that, water is 96%, urea is 2%, and remaining 2% are uric acid, urate, creatinine, chlorides, phosphates, sulfates, and oxalate. Next important point, green or brownish yellow urine that indicate bile salt and bile pigment, and reddish brown urine indicate urobilinogen, and bright red urine that indicate large amount of fresh blood. Okay, greenish or brownish urine means, brownish yellow urine means there is a presence of bile salt and bile pigment. Reddish brown means urobilinogen. Bright red means large amount of fresh blood, and pink urine that indicate small amount of fresh blood, and smoky brown urine that indicate blood pigments. Okay, smoky appearance with brown color of urine that indicate blood pigments, and milky white urine that indicate chyluria due to filariasis. This is important point, chyluria, milky white urine. This is also important point, sweetish fruity odor of urine that indicate the presence of ketone bodies. Ketone bodies means acetone and diabetic acid. Okay, it is seen in diabetic patient. Sweetish fruity odor. And cloudy appearance of urine is due to the presence of amorphous phosphate. Cloudy appearance of urine. Sweetish fruity odor in case of ketone bodies. The next is Urine test for albumin is hottest and cold test. Hottest and cold test for albumin. And test for sugar is Benedict test. As we all know how to do Benedict test, the reading is important. That's why I am telling the procedure of Benedict test. Okay, we are taking a test tube and adding 5 ml of Benedict solution, then boiling it by spirit lamp. Okay, holding the test tube away from the face, and then we are seeing the color changes. If there is no color changes of the solution, there is no impurities. Then what we are doing, adding 8 drops of urine into the test tube. Then we are shaking the test tube. Again we are heating the test tube, and then what we are doing, removing the test tube and allow it for cool. The result may be recorded on the basis of color changes, that is blue, green, yellow, orange and red. So reading of the test tube is blue liquid with no deposit means absence of sugar, green liquid without deposit approximately 1% of sugar, then green liquid with yellow deposit approximately 2% of sugar, and colorless liquid with orange deposit means approximately 3% of sugar. So, and brick red means it is 5% of sugar. So green liquid with yellow, colorless liquid with orange deposit, and brick red, that all indicate presence of sugar, and blue liquid means there is no sugar. And the next point, test for acetone is Rothera's test, and test for bile salt is Hayes test, and test for bile pigment is Smith test. So first two we discussed is test for albumin, that is hottest and cold test, and test for sugar is Benedict test. Remaining test for acetone, Rothera's test for bile salt, Hayes test for bile pigment, Smith test. These all important points.